Hello guys, this is Dr. Harpreet Singh, and today I'm teaching Step 2 CS class. I have written two books. One is Road to USMLE Step 2 CS and another is Vital Checklist. So as you know, I used to stutter myself and I could not even communicate my name. But now I get paid to teach. Isn't it amazing? I have my own radio show. So this is one of the techniques I tell all foreign students. Okay, all American students are fine, but all foreign students who come to give USMLE, they speak very fast and they will murmur and they will rush through. So they have to drop their jaws. They have to use these muscles. They have to do it very effectively so that American patients can understand them, but they rush and then they will fail the test. So I call this as a cardamom theory or raisin theory or almond theory or a candy approach. Whatever approach you want to mention is you take two cardamoms, okay, and here I have my student Sandesh, and he is going to demonstrate that. Can you speak something really fast or whatever? I know you have improved quite a bit, but I want you to speak something really fast. Let's say you are going to teach them about the malpractice test, which I just taught you. Can you please do that?
Yeah, okay. So when we are ordering tests for a patient, we have to make sure that we do order the tests and which are really important, and we are not missing on the diagnosis, which will land up, being a prey of a malpractice insurance. For example, if we are diagnosing a patient with a sudden headache, we have to rule out subarachnoid hemorrhage, and we have to order the CT scan for them. If there is a patient, a woman patient from age 12 to 50, and she's coming up with abdominal pain, before ordering any test, we know that we must order urine pregnancy test to rule out the pregnancy.
Now I'm going to stop you over here. Now you can pause our video and go back and see when he's looking at me, look at his jaw muscles. Okay, you will see that he is not opening as much jaw he should be, because he's from India and he's trying to improve his communication skills. Now I will ask to put these in his mouth, one on each side. Can you? Okay, and do not swallow this. This is how you're going to practice when you are practicing with other medical students. This is how you're going to practice. Now, can you speak? Now he will murmur a little bit because he has something in his mouth, but this will help him to improve. You will see that he is opening, and you can go back and see his first clinical scenario which he did with me, and we will do after training clinical scenario, and you will see his improvement. Please go ahead and speak. I know he will murmur. Do not try to understand, but just see his jaw muscles. Go ahead.
Okay, so now I am going to tell you about the counseling of the patient, that how do we counsel patient after we are done with the history and physical examination. So the first thing is we have to tell them about the follow-up, that when they should come back to a doctor. Then we have to tell them about the symptoms. For example, if the patient is diabetic, he can get hypoglycemic episodes, so we have to tell them that the sweating or the racing of the heart are there some symptoms of the hypoglycemia and they need to take some sugar. Then we tell about them the alcohol. If the patient says that he is alcoholic, then we have to make sure that we tell them that he should not take alcohol, as alcohol can aggravate his situation. Then about the activity. If the patient is hypertensive or if he is a patient of any other cardiovascular disease, we have to tell him the importance of walking, and we have to tell him about the importance of activity in his disease. Then talking about the medications. If we are prescribing some medication to a patient, we must tell them about the side effects of the medication. Then talking about the diet. Diet becomes very important. If the patient is fluid overload, if we can hear crackles on auscultation, or if the patient have a history of hypertension, of the history of heart failure, we have to tell them to restrict a diet which contains a lot of salts in it. And then driving. From D we have driving too. If the patient is having epilepsy or seizures, we know it is very important for a doctor or a physician to tell patient not to drive because it can be dangerous for his health also and for the health of other public personnel. So after that we have to talk about the tests that which we are going to order for the patient. There are some normal tests that we order. The first is the complete blood count, which we tell patient that we are doing this test as it will help us to rule out infections or anemia. Then we have to order tests which are included in complete metabolic profile, which include liver function test, renal function test, electrolytes, right? And then tests which are very case specific. For example, if we are diagnosing a patient who have a gastric ulcer, then we should definitely order H. pylori stool antigen so that we should know whether we have to start patient on antibiotics or not. Then secondly, if the patient, we are suspecting a patient to have osteomyelitis, then we should definitely order tests of the inflammatory markers like ESR, CRP. Then we should also order the bone X-ray to look if there is some underlying fracture as well. If we are on the similar lines of ortho cases, if we are suspecting a patient to have septic joint, then the first thing which should come to our mind is we have to do the aspiration of spinal fluid so that we can look at the level of WBC, the neutrophil count in the fluid. Then if the patient is having meningitis, then we have to explain the patient that we are going to take some fluid from their final spinal cord that we call spinal tap, as it will help us know the cause of the meningitis. So these are some of the tests we have to make sure, and we have to also make sure that that there should not be contraindications for some tests. For example, if the patient is having GFR less than 30, then we should not be ordering MRI with a contrast because it can cause nephrogenic systemic sclerosis. So this is what I feel.
It is marvelous. I'm so happy. And you can see, you can pause the video and go back before and after cardamom. You will see his teeth are touching before, but afterwards, because there is a cardamom sitting over here, his teeth are not touching and he's more clear and he's making a conscious effort to speak and he's using his hands. If you go and watch Steve Jobs, presentations, he uses more hands. He walks, he uses more hands. Hands are the non-verbal cues for the doctors. You have to use hands. Even if you are using a clipboard, you are holding a clipboard, then also you can, let's say this is a clipboard. These are my books, but let's say I'm holding this. Still, I will use hands. I will do this. I will, move forward, move backwards. These are the non-verbal cues. And you can see when he's talking, he goes up and comes back. He goes up and comes back. And he's forcing, and look at the, the tone in his voice goes up and down, up and down. This is how you should do communication skills. People say, oh, it is just a test, communication skills. No, this test will improve your interpersonal skills with the patients. This will improve the communication skills. This will help you with the non-verbal cues. I can guarantee you that this guy has a lot of potential. I think he's going to be a big shot doctor. You see that? How he improved in 2 days? You just see his before and after videos. You'll be mesmerized. If you want more training, you can join my workshop, Vital Checklist Road to USMLE Step 2 CS workshop. I do personalized training. I don't train 20, 30, 40 people. It is not an assembly line of training doctors. We do personalized approach. And please subscribe to my channel. Press on the bell icon. Leave the comments below. I will try to answer all the comments. But as you know, I'm a busy practitioner. If you have any questions, you can email me also. But don't forget to buy my book, Road to USMLE, and another book is Vital Checklist. You have a great day and hope to see you in one of the workshops. Thank you. Thank you for watching the video. Enroll now in our Lean Patient Experience Certification course, link in the description below.